Hello everyone, this is Dr. Indhumathi Kuberan, consultant diabetologist from Mumbai. Welcome to Diabetes Eye Openers with Dr. Indhu. Today I'm going to talk about the different types of patients, diabetic patients, which I encounter in my day-to-day clinical practice. There are three types I've encountered in my practice. I've been in practice for 25 years. Some of them are very casual in their approach. Some of them, one third of them, are really resigned in their approach. And one third are very, very proactive. Let me explain each type in detail. What does the casual patient do? The casual patient is unaware, blissfully unaware of the complications of diabetes. So he feels having a diabetes level or sugar level of around 200 to 250 is not going to harm him in any way. And even when they come for the follow-ups, which is very wide apart, they don't come on the fixed time. They come once a year or twice a year, and they come and argue with the doctor about the importance of keeping their sugar levels under control. Such patients are very, very difficult to convince to go on a diet and exercise program and to be compliant with the medications. Most of them miss their doses, miss their follow-ups, and have very poor glycemic control. Such patients are very, very difficult to treat. They become proactive only when they start getting the complications of diabetes. Only when their retina gets damaged or the creatinine starts rising up or they get a severe burning sensation on the feet, they become serious about their diabetes, but it is too late. The second category of patients are the resigned patient, negative patient, pessimistic patients. They have a very pessimistic approach towards their diabetes. They always come and talk to me as though diabetes is a killer disease, as though it is a terminal disease, and they because of the ill fate, they have got diabetes. They don't even want to talk about being proactive. They don't want to cooperate with the doctor, be compliant with medications. They always feel that their life is doomed because of the diabetes. Because of this pessimistic approach, they do not be compliant with diet and exercise. They eat whatever they want. They feel, I have only one life, doctor. Let me eat, enjoy, and go to God. They will never listen to the doctor about the importance of lifestyle modifications or the importance of taking the medications on time. This second category of patients, the resigned patient, is very regular with the follow-up, but always negative in their approach. Even this category of patients I have seen, the HbA1c levels are always high, and they also eventually land up with the complications of diabetes. There is a third category which I really enjoy to treat, which is proactive patient. These patients are really positive. They really educate themselves about the disease and they know how to self-manage their disease. They come to me just for management of their medications and for general advice. They go a step further about being compliant with diet and exercise. And they monitor the sugar levels very, very regularly, and most of them share with me on WhatsApp. That helps me to down titrate or up titrate the doses according to the sugar levels. This category of patients do very well. Their glycemic control is always good, and their life is without complications of diabetes. They live very productive lives, and as doctors, we enjoy treating such patients. But remember, it is never too late for the casual patient or the resigned patient to become proactive. So be proactive and beat diabetes. Thank you.